Thank you so much for joining us today for this webinar. I think it should be a really great discussion, and I'm very excited to be part of it. So this webinar is one of a series that's being led by the COVID-19 Transparency and Accountability Project in collaboration with Global Integrity and many other great organizations. And we're so excited today to have three transparency and accountability experts who are going to be able to speak to the real experiences of implementing better transparency, participation, and accountability practices during the pandemic. So looking at the places where governance may have failed and what strategies were effective in achieving openness and accountability in government response during COVID-19. My name is Courtney Tolmie. I'll be the moderator for today's discussion. I'm a senior fellow with Results for Development and founder of Wonderlight Consulting. And I recently had the opportunity to lead some research with the Transparency and Accountability Initiative, looking at lessons in pandemic governance from the TPA community. I think what we saw was that the lessons from this research really revealed how much the health field can learn about resilience and inclusiveness and effective health delivery, budgeting, and governance during global health emergencies from the TPA field. So really excited to have this conversation today. We have three fantastic panelists with us. In a few minutes, hopefully, we'll be joined by Dr. Angela Benson, who is the Deputy CEO of Benson Hospitals and a leader in global health medical education and implementation monitoring and evaluation in Liberia. Second, we have Nancy Saibo, who is the program lead for Actions for Development and Empowerment in Cameroon and one of the CTAP project partners. And finally, last but not least, we have the country lead for budget in Senegal, El Hadj Amadou. So thank you all so much for joining us today, and we're excited to get into this discussion. Just to give a little bit of housekeeping for everyone who's been able to join today, we'll have about 30 minutes to hear from our panelists about strategies and challenges to building accountable and inclusive health systems. As I ask our first question to each panelist, I'll also ask them to briefly introduce themselves and then share their reflections, taking about 3 to 4 minutes each, so we have plenty of time at the end to also respond to Q&A from the audience. As we're talking throughout the entire webinar, please feel welcome to share your questions and reflections in the Q&A box. We will try to respond both in the moment, but also, as I said, at the end, we should have some time to directly respond to Q&A. So let's go ahead and get things started. So to start with our conversation, I would love to begin by kind of looking back over the last 2.5 years. So reflecting on what we've seen from the COVID-19 experience. And Nancy, maybe I'll start with you to share more about your experience in Cameroon. So could you share a little bit about strategies related to procurement or governance or other issues that you observed in the government response that was especially effective in COVID-19, or on the flip side, things that you saw in Cameroon that you think were not effective in terms of ensuring accountable and inclusive health systems?
Okay, thank you, Courtney. I'm just gonna do like a fast step back to 2020 when COVID-19 first arrived Cameroon. So we had our first case in March 2020. And it's important that I note that Cameroon was already facing several crises in the country, where we had the political crisis in the northwest and southwest region of the country. We have Boko Haram in the northern region, and we have the refugees crisis in the eastern region of Cameroon. So the first COVID was detected, like I said, in March 2020. Since then, we have numbers of cases that were rising, and Cameroon was the most affected countries by then. So I'm going to go straight to how government mitigated this negative effect of the pandemic. So we have the authorities, Cameroonian authorities, that opted for a responsive plan. And that plan was to both to eradicate the disease and to reduce the production or the effect of COVID-19. So they had like 5 major pillars to fight the coronavirus in Cameroon. So we had the health response, we had the economic and financial resilience, we have strategic purchasing, and we have strengthening of research and innovation, as well as social resilience. The implementation of this response strategies was hampered by highly centralized and heavily bureaucratic nature of the governance system in the country, especially at the level of purchasing arrangement, where all decisions were taken from a central level and funds were also managed at a very central level. So, but we can see that fast forward April, we had the Ministry of Health that came in with an intensive management system. The intensive management system existed long ago in 2015, and it's been led by the Prime Minister, which is the head of government. And this, they created this intensive management system in 2015 to manage major public health crisis in Cameroon. And the first experience they had was with the cholera in 2018, but this wasn't effective. So let's look at COVID. In April 2020, most districts had not yet received rapid diagnostic tests to manage COVID cases. So we had civil societies organizations that advocate for that districts should have the tools needed to combat COVID-19. By June 2020, we saw that the tax was gradually shifting from hospitals to general hospitals to the district, where they began training healthcare providers on managing COVID cases. Many districts could now carry out testing and even manage COVID patients. There were more massive sensitization and screening. So fast forward to August 2020, the Minister of Public Health directly supported all districts in Cameroon financially with a commendable speed fund. But we know we have beautiful policies put in place by the government to make sure that the pandemic are being managed. But when we go to the rural areas, it is not the case. So we carried out a research on primary healthcare services. We wanted to understand how primary healthcare services manage the COVID, and we saw that there was a whole lot of gap. So we had to compare what is written from the press release, from what is written in the policy. Is the implementation really concrete? When you go to the rural area, we have a lot of questions mark. But today there is enough testing kits in most of the public health facilities in the country. Currently, all districts have been empowered with purchasing arrangement, in particular for the acquisition of COVID test kit. So we have like 4 specific purchasing elements that the government uses in Cameroon. So they have like the governance. At the level of the governance, we have the Interministerial Committee on COVID-19 chaired by the Prime Minister, head of government, that was established to coordinate multi-sector response to COVID-19 in Cameroon. So including resource mobilization, prioritizations of need, a number of cases kept on growing, and the alarming rate of this COVID-19 change in purchasing decisions. So it shifts from district levels to reactivation of incident management system. Like I said earlier, the incident management system came in since 2015, but it was dormant, it wasn't active. So with the COVID-19, it became more active. It became active, not more active. So we have, I named the governance. The second strategy the government used was resource mobilization and allocation. In order to cope with the increase of resource needs to contain COVID-19 pandemic, the head of state created a special national solidarity fund on March 30 to initially help with fighting and managing the COVID-19. So there were already existing, there was this fund that was emergency fund that was already existing to manage future pandemic, but we really do not know how these funds have been managed, because 10% of every district, they have like, they give 10% every month in this emergency fund, but we don't know how this money is properly used. So this was one of the reasons that we were advocating, like we want to know how funds, emergency funds are properly used, better understand how government manages the pandemic. So I will go to the payment of payment mechanism, which is the third strategy the government used. Adjustments were made to allow flexible and rapid use of funds by providers. Incentives such as extension of retirement age of public health personnel was introduced to motivate health workers. I think not all health workers were happy with this decision that were made, because they felt like they were not taking care of those that were affected by the pandemic. Felt like the government did not pay special attention to their need, given that they are healthcare providers. The fourth strategy the government used at the level was service provision. Few accreditations and expansion of public treatment centers and health benefit package, including testing, hospitalization, medication were instituted. So we saw that centers were created in the 10 regions, but this came in with time. It's not like they were ready for this pandemic. It's with time that, like, I try to give the date and the month, so you see how as time goes by, government is trying to make some adjustment because no one was ready for the pandemic. But like the same, we still have a lot to share. So I'll just go to the lesson. I just made a presentation and I'll just go to the lesson learned. I know I have just few time to share this, but I think it's important.
Yeah, and we'll have a little bit more time later, but maybe just one or two lessons, that would be great. Thank you.
Yes. So we it is important to state that the lesson learned and the results from the decentralized management of COVID process and the adjustment of purchasing policies for health services. One of them is there is a great need for the development of more intensive, broad-based, integrative, people-centered, bottom-up, and multi-take stakeholders process for purchasing management in Cameroon. One last one, the technological improvement achieved in dealing with COVID-19 pandemic can be used to establish a robust information center system, an early warning system with an effective communication and feedback mechanism where government leaders, civil society, and other constituents can directly contribute in preparing to prevent and respond to immediate challenge, whether on healthcare or war-related crisis. Thank you.
Wonderful. Thank you so much, Nancy. I think you shared so many insights that definitely resonate with, a lot of what we saw in some of our research. This issue of purchasing and the challenges with purchasing in a health emergency. You also raised the point about your organization coming in to do oversight and accountability, which, played such an important role in so many places. And also this idea of bringing in more multi-stakeholder approaches. And so along those lines, I actually want to turn to our next panelist, Amadou. So Amadou, I know that in your work in Senegal, one of the things that you're working on is creating a multi-actor, multi-stakeholder observatory of accountability to really look further into those challenges in the health system. So can you talk a little bit more about that and your experience doing this work during the pandemic in Senegal?
Okay, thank you very much for giving me the floor, and thank you for the listeners, and very sorry for the Senegalese accent, right? Maybe I think that we are going to try to do our best so that everybody will be able to understand. I'm going to start first with COVID-19 before coming to the observatory, because in Senegal, the COVID landed in March, and when the first case was recorded in Senegal, the first thing that the government actors thought that was important was to close everything relating to airport and port. So everything relating to travel was limited, and the movement in the country was limited as well, except the movement for doctors, for journalists, people in the army, and some section of the population. And that has helped to reduce the number of cases, because the number of cases for Senegal didn't get more higher because we had got a kind of organization, a quick response, if we can call it like this. And then after the government has establish a strategy for giving a fund, right? Having what is called the resilience plan. It is a plan for resilience that was declined on 4 axes. There was just one axe that was dedicated to how to maintain the jobs. The second one, how to try to make people resilient. The third one about the health, how to support the health system, and the last one, it was to help people by providing them commodities and things like this, and that has started to be implemented. Maybe we had a lot of question, a lot of problem about how the fund have been distributed, what are the people who participated, and even the way that it have been done. And in the juridical framework, there have been some law that have been enforced in order to limit sometime the time that people were moving from the morning to the afternoon. The school was closed, and even some places for worshiping the religious places was closed, as well as training school. Every place is where we can have people that gather there. And then we had got a good result in Senegal, but COVID-19 has shown some challenges, some problems, because we have noticed that the health system, healthcare, was not that much taken into account by our governors, because COVID has shown all the problem that we had in the healthcare system. And after, in the CTAP project, we have implemented some research that show us a lack of accountability, mainly in the health system, because our meeting with PGOs had showed us we have many devices, many instruments of accountability, either in the finance system, in the extractive resources. But till now, we have noticed that in Senegal, we don't have an instrument that is mainly dedicated to the health sector, and that will be in charge of accountability. And in our first coalition meeting in Senegal, everybody has recognized the necessity to have what is called an observatory. And how we do, we have gathered all the stakeholders, meaning the health professional. We have gathered the civil society organization working basically on health and who had made a lot of job in this, the institutions, the unionists, even as well as the journalists, right? And all the people that are working in information access. And we have noticed the necessity to have this instrument, and then we are trying to do the advocacy. And I can say that we have an engagement from civil society. We have also engagement in our town hall meeting of people at the grassroots, and the engagement of our other fellow stakeholders, mean unionists. And we are designing, for the time being, we are designing an advocacy note that will be submitted to the President of Republic and the Commission of Health in the National Assembly for the advocacy, because we have said that if we have this instrument, multi-actor instrument, that will be dedicated to accountability, mainly for the health sector, that will be able to help us in order to prevent everything relating to information access, a lack of accountability, and a lack of problem. And this will help us also to say what are the real problems that we have in the Senegalese health sector. And I will finish by this, because we remember the declaration of Abuja. Senegal signed that declaration in order to have at least 50% of the budget that will be dedicated to health. This haven't been done. And this observatory will be an opportunity for us to do the advocacy for all those things. And thanks to God, we are in a good right? We are working a lot in this, and we have met many actors of the government that are supporting us, and we have at least 15 relevant civil society organizations that are supporting us, as well as the people working at the grassroots, right? So I'm going to finish with this. Senegal is, I won't say a small country, but it is a country that is weak, economically weak, and the COVID-19 has decreased many things, right? With limitation of movement, bearing in mind that Senegal is a touristic country, and then we have the losing many jobs with COVID-19, and now people are in how to reharmonize the economy, and the civil society actors as well as the stakeholders, thanks to all the data we have collected in our research in the CTAP project, and also the help of all the stakeholders, including the community radio, the media, and the other actors. We hope to have that instrument that will help us to face the others pandemic like COVID-19 or things like this. Thank you very much.
Thank you so much, Amadou. I suspect we'll have a lot of questions in the Q&A box about how you were able to bring together these different actors, this very diverse group, to build this multi-actor observatory. And, you know, I think one of the really interesting things about what you shared, and it's something we hear from other partners as well, is that, you know, while the pandemic brought many challenges to the surface, a lot of organizations, especially civil society organizations, were able to use the pandemic as a catalyst to create these mechanisms for accountability that will far outlast the pandemic, that really look at larger health systems, and I think have the potential to have an impact outside of just the confines of COVID-19. So thank you so much for sharing that.
Thank you.
Great. So next, I'll turn to our final panelist, Dr. Angela Benson. Angela, you know, we've heard from experiences and examples from Cameroon and from Senegal about strategies, often from civil society, but also from the government, that worked well in terms of achieving transparency and accountability during COVID-19, as well as things that kind of failed or didn't work as well. So Angela, could you share a little bit more from your experience in Liberia, you know, looking back at the last 2.5 years, strategies that worked as well as any strategies that didn't seem to work in terms of government's response to COVID-19?
Thank you. Thank you for having me on this conversation. I'm excited, and thanks for all of the good work that you are doing as organizers. In Liberia, as you may be aware, we have experience with Ebola epidemic in the year 2014, which lasted almost a year, in which we have lost over 20,000 lives, including 20 health workers. So that already showed the weaknesses in the health sector. We were not prepared for to handle an epidemic. So while we are struggling with that, the community members, they mobilized themselves, and they were able to say, no, we see our children dying, our relatives dying, our sisters and brothers dying, we need to do something. So they started by making sure that they wash their hands, by making sure that they wear gloves. If there are no gloves, they use plastic bags to even cover their hands while taking care of their babies. So the initiative was first of all initiated and acted upon, implemented by community women in terms of doing things for themselves. Then after the Ebola, then came the pandemic, COVID-19. And so the lessons learned from Ebola, handling Ebola, some of those lessons as infiltrated and are still part of the community handling the COVID. That has to do with making sure that we wash our hands, we keep the distance from each other, and also to make sure that whatever we do, we encourage one another to take the vaccines. So that community information is going on and is trying and has been ingrained in many communities. However, there are, as you know, for you to have an efficient response to any epidemics or pandemic, you need to have medical supplies in timely, you need to have the right quantities, you need to make sure that if the quantities are able to handle all of your target population, and you need to make sure that people who are ordering these quantities of vaccine, test kit, or medical supply know exactly what to do. So for a good example, in Liberia, we have had procurements, for instance, to handle moderately malnourished children, high protein biscuits, vitamin A tablet, as well as folic acid in a bundle. And those estimates were done not only by government, but by the implementing partners as well, so that there is collaboration between the government and the implementing partners in ordering those quantities. In such instances, the quantities were estimated at the right time, and they were able to be brought in country to meet specific target population, that is moderately or stunted children. And that is a good example in that you are able to avert children going into severe malnutrition because they have this high protein biscuit and they have the iron tablet and the folic acid to help them out. However, we have many examples where the procurement mechanisms have not always worked well. And in the case of COVID-19, we have delays to have the vaccine in country. We have delays to have the test kit into Liberia because it was highly centralized and the decision-making was not decentralized. It was highly centralized. It was made by few people, and the other people do not know what was happening. We were just in the dark. And in such instances, when there are delays, you know that there is definitely lack of transparency, and delay also lead to lack of accountability. So with all of that, we thought that what do you need to do to make sure that such delays are not repeated? We think that by making sure that, for instance, the cold chain is maintained from the manufacturer all the way to the central stores when it arrives in country, all the way from the central store to the county, from the counties to the district and to the end users. You need to maintain the cold chain, and you need people, you need trained people, you need people who can handle the equipment, you need people who can give the vaccines the right way, trained people who are able to administer these vaccines. So all of the steps need to be in place. When the procurement mechanisms were done centrally and not decentralized, you have a lot more delays. And when the procurement mechanisms are so cumbersome, so difficult that only a few people can handle it, it's not helpful to the country, and it also leads to poor accountability and lack of transparency. Therefore, we are recommending more decentralization in decision-making, more decentralization in handling of funds, so that the communities are able to make decisions from the bottom up. Also, we know that the CSOs were able to use a lot of the information from Ebola to COVID to be able to help themselves in making sure that they are more accountable. They are more accountable because decision makings are done by many people all the way down, and they are collaborating with more and more people. If you are not accountable and they are not transparent, there are a lot of people who will ask questions. What is happening here? What are you doing to help us? But in the case of a highly centralized government procurement mechanisms, there are very few people who can come out to confront the government, to ask questions why these things are delayed. But in the CSO, you have more people making decisions and you have more collaboration. Therefore, this enable more transparency and more accountability in whatever they are doing. And that helps the country to be able to move forward in terms of what needs to be done better within the health system.
Wonderful.
Yeah.
Thank you so much, Angela. That's great. And I think, again, you've shared so many important points here. You know, this issue of decentralization, allowing for, you know, better functioning health systems, especially during a health crisis like the pandemic, like Ebola. I think also a number of your points about procurement. You know, we often think of procurement as just about securing the supplies, but it's so much more than that. It's ensuring that there's people who are trained to provide them, that you have the distribution system in place, and that there's those accountability mechanisms. So
yeah,
thank
but,
you.
I wanted to say that before we go to the next talking point, that there's need also for people to be willing to learn in the health system, such that those who are willing to learn are able to learn the procurement system. And we talk about decentralization such that the decision making is shared by so many. And that leads me on to say that we'll be better prepared to mitigate further emergencies, for instance, what are the things that we need to do, for instance, to be able to be prepared for the next emergency. There are issues of what we are doing now. What are we doing right? Are we doing preparedness plan? Those are the kind of things that we need to do for preparation to mitigate the next emergency. We should have a national preparedness plan. We should make sure that we estimate those quantities of vaccines and test kits, medical supply that is needed. We should also make sure that we are able to help people in terms of pre-positioning of drugs or vaccine in hard to reach areas where the roads are so bad, they cannot access them easily. You pre-position all of these supplies there ahead of time before the emergency. Because once the emergency hits, it's too late to act. I think we should have plans to even have simulation exercises for the seniors, for children, for nurses and doctors to know what to do and simulate activities before it happens, so that all of these lead us to be well prepared to handle the next emergency. And also the collaboration stage cannot be overemphasized, because we all are working for the same goal. We all are working to make sure that the health system is strengthened. Those who need services get quality service. And if we work together collaboratively, we'll be able to be more accountable, we'll be able to be more transparent, and it will be a win-win situation, both for the community members and for the government and for CSOs and all the implementers.
Wonderful. Thank you so much, Angela. And you actually predicted my next question for the panel, kind of looking forward. Before jumping into that, I do want to remind everyone, we do have the question and answer box open and available. I am going to ask one final question to everyone on the panel and ask for relatively short responses, maybe 2 minutes each. And then what we'll do is we'll turn to the Q&A box and would love to hear from everyone in the audience. What questions do you have for our panel about building inclusive and accountable health systems? So as everyone in the audience thinks and hopefully shares some of your questions in the Q&A box, I will ask one final question to our panel. And my question goes to everyone. So looking forward, what are 1 or 2 very concrete recommendations that you would make to the government to ensure that their response for the next pandemic or the next global emergency is better? So if you had the ear of the government and can say, these are the 1 or 2 things that we really feel like you need to do to ensure good governance, transparency, and accountability during the next health emergency, what are those recommendations? And I'll go back to Nancy maybe to kick things off. Nancy, I'm not sure, you may be on mute if you're trying to respond. We can't hear you.
Can you hear me? Can you hear me now?
Yes, we can hear you now.
Okay, sorry. So thank you. It was very interesting to listen to my colleagues. We both have similarities, like we are facing the same problems, both in Cameroon, Senegal, and Liberia. So I was talking with my colleague because we brainstormed on what we want government to do, because this is a collective work, and I want to make sure that I have their mind in this meeting as their leader. So the first thing we want government to do is they should be more transparent and accountable in the management of emergency fund for the health system, because we already have this like reserve of fund for emergency purposes, but we don't know how it is being managed. So they need to be explicit and clear on how to manage these funds. And secondly, we want the regional and district hospitals to be well equipped with modern healthcare equipment, because during our primary healthcare service, we were tracking primary healthcare centers, and we saw that some of these district hospitals don't have they're not well equipped. So if they're not well equipped, and if we just imagine that we have future pandemic, it is very, very difficult to deal with pandemic when we are not well equipped. So sensitization to the population really need to be aware that we have a role to play in the development of the health system in our country. So no one should be left behind, both civil society and the population. We need to come together, and we want a bottom-up system, even if it's very difficult, because we see that it's top bottom. So we want a bottom up system when it comes to healthcare. And we Cameroon's level of preparedness for the future response still needs to be improved. That one, there's no argument about it. For example, the emergency numbers should be permanent. So let's not just wait for a pandemic to have emergency number. We should have an emergency number that is permanent for future pandemics such as cholera, because Cameroon is currently having a cholera crisis as well. The better management of emergency reserve established by the government in 1993 should be very, very well taken into consideration, because we know that a healthcare facility pay 10% of their revenues each month, and these revenues are largely comes from the patient fee. So we don't have to joke with patient fee. People are first of all suffering from poverty. So the little we put it into the reserve, we need to be informed on how this percentage is being managed. And I'm going to be closing. And so government should create special centers in the regions. We have, Cameroon has 10 regions. So we are calling on government to create special centers in these regions and districts to be ready to intervene in times of pandemic, and create also molecular biology laboratories, because we lack laboratories in some rural communities. So it's important that we have these laboratories that are going to initiate actions to promote the local development of an entire pharmaceutical industry. And it's also important to fight against inequalities by facilitating access to health in the pandemic, because we cannot be talking about transparency, accountability, and citizens' participation where the facilities, access to these facilities are very, very bad. So just to name a few, these are the recommendations that we as ADE, and given the fact that we've met with other stakeholders, we've organized coalition meetings, these are some of the recommendations that we came up with. And we are hoping that a collaboration with us and the government is very necessary, so that we can join forces and fight future pandemic, and together we can develop our country. Thank you.
Wonderful. Thank you so much, Nancy. And I appreciate that so many of those recommendations are things that the government could be doing now. It doesn't need to wait till the next global emergency. Although, as you said, Cameroon is facing a cholera crisis right now, but these are things that can be done even, before the next COVID-19. Yes. Amadou, I'll turn to you. Same question. What are the 1 or 2 recommendations you would have for the government of Senegal in preparation for the next health emergency?
All right, thank you very much. So the first recommendation will be the creation, as you know, of the multi-actor observatory of accountability in the Senegalese health sector. This is something, a need that have been expressed by all the members of the people that are working in the health sector. And we want is to include the health professionals, the government members, the unionists, journalists at the local level and also at the national level, the private sector, as well as the parliamentary and all the organization at the national and at the community level. Right. The second thing is to improve the scientific innovation about health, because this pandemic has showed us the scientific innovation in terms of health. We have seen many young people from a school, for example, called ESP here in Senegal, with young students who have created masks, who have created the gel, alcoholic gel, and who have creating very relevant thing that can be supported by the government in order to have champions in entrepreneurship. It is just to develop local entrepreneurship relating to health and all kind of facilities. And the other one is to a recommendation is to enforce the law of information access. We have a law of information access here in Senegal, but the law haven't been enforced so far. And the last thing is to develop a mechanism for claim, right? A claim mechanism in order to help people to be able to claim and to allow authorities to be informed for all those problems. But the key recommendation is a creation of observatory, because we consider it can help at least 60% of problem. Thank you.
Thank you so much, Amadou, and something you all are already leading on. So already taking those important steps in preparation for the next emergency. So Angela, I'll turn to you. Last but not least, I know you've already shared several recommendations, but are there one or two concrete things that you would say you really want the government of Liberia to implement in preparation for the next pandemic?
Yes, thank you. One, two or three things. One is that the government should really have a transparency and accountability commission that looks at all of the supplies, all of the estimates that come into health. This commission doesn't necessarily have to be on health, but on all the other sectors, but the health should lead the group. Because when there is health emergency, it deals with life. And if there's no life, you cannot develop in the other sectors. So we really need a commission that looks at accountability, that looks at transparency in all government funding and in all aspects of emergency handling. Secondly, we need decentralization of power, of decision-making, of funding, so that that works all the way down, so the counties, to the district, and to the health facilities. So they make decisions at their own level and they are able to be empowered to help themselves and not waiting for the delays in government processes, which is highly centralized and very, very cumbersome. The third thing is having a plan, a preparedness plan that is national, and that decentralization of the estimates, the quantity of things that are needed, be it medicine, be it vaccine, be it coaching, be it test kit, those are estimated and they are already there. So that it's not when there is emergency, we start planning. We already have that as part of the government machinery, and they have funding and budget allocated for emergency. That funding and allocated for emergency should be part of that plan, so that while we are waiting for help from other people or from partners, the government is able to help itself first. and not have to wait till many people die until we have international partners come and help us. So if we have this plan in place, we have a budget for it, and we are able to implement, we will be accountable to ourselves with this transparency commission that is already set up. And lastly, training of all cadres of health workers, including training the laboratory technicians, training the procurement officers, training the people who give us the data and information. That is very important at every level, at every sector of the health delivery system, all the way down and bottom up and down and then top down. Thank you.
Wonderful. Thank you so much, Angela. I saw Nancy clapping. I think we have a lot of exciting responses and great things to kind of foster our discussion for the last 15 minutes. So I want to open it up now. For any of our participants that are on the line, please feel welcome and encouraged to share your questions for the panelists. You can share them in the Q&A, or I think you can let us know if you want to speak up as well. I would also invite the panelists, if you have questions for each other, you know, this can also be an opportunity for us to share, even with those who are sitting on this panel as experts. We have a great group here, and I know there's a lot of peer exchange that could happen that could support. So I'll pause for a moment and see if anyone has any questions that you'd like to share.
I think I have a question.
Yes, go ahead,
okay.
Nancy.
Thank you, Kathy. So I was very excited to listen to Dr. Angela speak, because I feel like Liberia and Cameroon share some similarities when it comes to healthcare challenges. And I like the fact that she mentioned about the bottom up and not up, bottom top and not top bottom system. And I just want to know, at the level of Liberia, how did civil society engage with government? Because we're talking about transparency and accountability, but we want to know the role civil society in Liberia played during the pandemic. And was it responsive? Like, was the action really heard? Because sometimes we feel like the government deliberately decide not to listen to civil society organizations. But I want to know how civil societies in your country participated in managing COVID as well, not just leaving it for government to do it, because we both know that we have gaps in our health system, but we also have roles to play like citizens or like members of civil society organizations. So just tell me a little bit how civil society organization, the role they play in making sure that government manages the COVID-19.
Thank you so much. That's a very crucial point. In Liberia, the civil society organize themselves into their own group. They have an umbrella organization. Even the private health sector have an umbrella organization. So they have these associations, but the government is doing a different thing. The civil society is doing their own things. There has to be more collaboration, more listening to each other. But right now, because of COVID, the government were forced to listen to the civil society because people were dying and government system, as I say, is slow and cumbersome. So when they saw that the civil society and community members stood up and they were doing things, implementing activities that was halting and decreasing death, they have now to say, oh, if they are doing it in a society in West Point, or they are doing it in Pittsville society community, there must be something good that the civil society are doing. So this civil society themselves have organized themselves and say, we cannot wait for government to help us. We need to help ourselves. And because of that, they were able to use homemade materials, because there is no money. They don't have a lot of money. So they were using technology, appropriate technology to save life. I talk about using plastic bags as gloves. Plastic bags, you know, those black plastic bags when you go in the market, that's what the women were using as gloves to take care of their children, because there are no gloves and these things are body fluids should not touch each other. So they were using their brains, they were using the means that they have to survive, and not waiting for government to do everything for them. Therefore, the government now was forced to say, oh, we need to start doing the same thing that the civil society were doing. We need to start training our people to really know the health system, to really know what to do to prevent COVID. Because as I said, we had Ebola and we have learned to wash hands, to keep clean, and all of these things. So it was part of the community, so let's say, way of life, because many people died, relatives died. And because of that, they want to do the same thing when COVID came. And when COVID came, before the government would have partners come to help us send vaccines and all of that, community members were already doing the right things. But there are still challenges that in terms of communication, in terms of collaboration, in terms of really having the system listen to the recommendations from the community, from the CSO. That channel is still very weak. It's been strengthened, but it needs to be strengthened more so that the best practices will be highlighted and the government will use it. And that collaboration is where you all come in, and our project in Liberia also comes in, because with Abraham and his group talking about it and meeting with the county officials, it brings out the awareness that there has to be that collaboration amongst each other. Thank you.
Wonderful. Thank you, Nancy, for that great question, and Angela for the equally great response. I'm just looking here, and it looks like Isabella has a question. Isabella, do you want to go ahead?
Hi, thank you so much, esteemed panelists and our wonderful moderator for bringing this conversation to life. Fireside chat sometimes gives this moment to have a more dynamic and interactive conversation. So I'm really happy to see you both talking about it. I wanted to also bring in Amadou, if he's still online, and ask about CTAP's role in all of your efforts of connecting civil society organizations, people on the ground who are ordinary citizens that are doing this amazing work to thrive and survive, and also how they work together with government agencies to build better systems for now and for the future. Thank you.
Wonderful. Great question, Isabella. It looks like we have at least temporarily lost Amadou, but maybe Nancy and then Angela, would you all be willing to respond? And hopefully we'll get Amadou back as well.
Okay, so I will just go. So what we did at the level of Cameroon with the CTAP project is that we organized coalition meetings where we did like a stakeholder mapping of organizations that are interested in the health sectors, and media as well. We didn't just focus on civil society, we invited media because they're gonna help us with our advocacy. So we invited all of these people and some government officials which came, because it's very surprising that government officials come for some such meetings, but we like the fact that government now have understood that we all have a role to play. So during these meetings, we told them, we shared our experience and our research results from the different regions that we visited, and we told them, okay, we are on the field, we understand the cry of the population, this is what they are facing, this is what they are asking. We feel like if you solve this problem, there's gonna be peace, because I can imagine the pressure. Sometimes we're always asking from government to do this, to do that, but we also understand that they have this pressure to, no one was expecting COVID. So we try to make them understand that we are not here to fight you, actually. We are here to collaborate, because we feel like we need to tell you exactly what is happening. And that is why we don't want to take it as just my organization that I lead, like ADE. We invite other organizations from the 10 regions of the country to say, okay, this is the recommendation we are taking to the government. It is not just ADE that is taking this recommendation, but it is we as a nation, or as we as civil society organizations that are working in this sector. This is what we want to see in the future or in the health system, because we don't want to just wait for pandemic to happen for things to change. We want to use COVID as an example so that we are ready for future pandemic. So we built coalitions of civil society. We created a WhatsApp group where we share information, and I was very happy because Adamu mentioned about the access to information. Cameroon does not yet have the access to information. So why talking about bringing coalition civil society together, we're also advocating for the Information Act to be signed, because we feel like it's a better tool for our work. If we want to advocate, we need data. So it's a working process, but we are gradually moving to that area where we have a partnership with the ministry in charge of health in Cameroon, the Ministry of Public Health, where we share with them our findings, and we advocate for better collaboration and better health service deliverables in the regions where we carry out our research.
Thank you so much, Nancy. That's great. So I will turn to Angela for a quick response, because we do have one final question. I think, Abraham, you will have the last question, so we'll do a quick round. Angela, over to you to respond to Isabella's question, and then we'll open it to Abraham.
Thank you. Just as a quick answer, it's almost the same thing like Nancy has said in Cameroon, because the civil society, they do have their cohesion, collaborate more with each other, and they come up with these resolutions. And in their meeting, they do invite the government officials, and also vice versa. The government do invite the civil society, and there is now a section in the Ministry of Health in Liberia which look at all of the civil society and the private sector. They actually have a division for that. So that division is still very young, is still looking at ways in which they can collaborate more, and also be able to advance guidelines, policies that will help both the private sector as well as the civil society combine with government and have a holistic health system, not just 40% or 60%, but 100%. So we need each other, and it's work in progress in Liberia. Thank you.
Thank you so much, Angela. Abraham, I will turn to you very quickly to share your final question.
Yeah, good afternoon from my end. So I'm Abraham Vani. I'm serving as the country lead for Budget Liberia, and also heading the CTAP project in Liberia. So let me first say thanks to all our speakers. And then while they were speaking, I saw a lot of similarities when it comes to challenges and even opportunities that do exist. So it's not really a question, but it's a comment. And one thing that we have understood when it comes to the entire CTAP project is the issue of collaboration among CSOs. So I can recall when we started the CTAP project phase 2, there were a lot of bureaucracy in working with the Ministry of Health in Liberia. But then looking at that, Benson, who have worked with both the government on different projects within the health sector, were able to collaborate with her. And then just a single email was able to create that, was able to bring down that entire bureaucracy, had a meeting with the Ministry of Health, and then they were able to give her their full support on the project. So that's just how it's very important to collaborate within the CSO space. Another thing that we were able to successfully do is the issue of our town hall meetings. So what we understood is that initially, both the service provider, which are the health workers in these public facilities, and that of the citizens who go there, both of them had different perception when it comes to the challenges within the sector. But then during our town hall meeting, we brought all those stakeholders together in one room. So the service provider, which is the health workers, will be able to tell you the challenges. Like, for example, we got to understand, we understood that medical supplies in these hospitals, there's no pre-assessment done before these supplies are made. National government just supply this hospital with any kind of drug. So when these health workers were making these citizens who go for these services aware that this is how it works, it started to change their perception about even the health workers. They're like, okay, but you guys are doing extremely well. We're really aware that these are challenges you guys go through to just provide services. Some of the health workers will tell you that, okay, I even use my phone line at times to attend to pregnant women, to attend to sick patients because there's no electricity within the facility. So both of them, both stakeholders, the service provider and that of those who go for those services, try to understand that, okay, we all have challenges and how can we collaborate together with the health worker instead of them seeing them as antagonists. So that is just something I wanted to share with everyone during our engagement in Liberia on the CTAP project.
Wonderful. Well, Abraham, thank you so much. And I think we will make that the last word for this fireside chat. So many interesting perspectives and ideas. I can say I definitely am walking away with a lot of new ideas and thoughts about how governments can be better prepared and engage better with civil society for the next global health emergency. So I would like to just take this last moment to thank our wonderful panelists, Angela, Nancy, and Amadou, and to thank our coordinators and organizers, Carlos and Isabella. I thought this was a great discussion. We could have spent much more time. For anyone on the line who is interested in learning more about CTAP, please get in touch with these panelists and organizers. They're doing incredible work, and I'm sure there's a lot more that we can share. And I believe Isabella just shared in the chat the website for CTAP. So please stay in touch, and we'll look forward to the next time we can all connect. Thank you.
Thank you.
Take care. Bye.
Thank you. Bye.
Thank you, Courtney. Thank you, Isabella. Thank you, Carlos. It was a very amazing session. I learned a lot, and we're looking forward for more engagement. Dr. Angela, you're doing an amazing work. Adamu,
Thank you.
keep pushing. We see you. Bye.
Bye.
Thank
Thank
you.
you.
Thank you all.
Thank you for
Sharing your
all of you,
insights.
the organizers. Thanks for having me. Bye.
Thank you
Bye.
all.
Courtney,
Bye.
Nancy.
Bye.
Bye, Carlos. Thank you.